I am going to tell you something now that no pharmaceutical company will ever advertise, no morning news segment will ever cover, and no 12-minute office visit will ever have time to explain. There are 4 specific over-the-counter and routinely prescribed medications that nephrologists, the doctors who specialize in kidneys, quietly refuse to take themselves once they pass the age of 60. These are not exotic drugs. These are not banned drugs. These are pills that millions of American seniors swallow tonight, with the full belief that their doctor has approved them and their pharmacist has cleared them. And yet the kidney specialists who study these molecules for a living, who read the biopsies, who watch the GFR numbers fall in slow motion across a decade, when those same specialists turn 60, they put these 4 medications down and they do not pick them back up. I'm Dr. Richard Foster, and over the past 8 videos in this series, I have walked you through the foods, the tea, the lab tests, the morning routine, and the bedtime habits that protect your kidneys after 60. Tonight, I'm going to do something different. We're going to tell you what the kidney specialists themselves avoid. We're going to count down 4 medications from number 4 to number 1, ending with the single pill that may surprise you the most. A pill so common, so trusted, and so heavily marketed for nearly a century that you almost certainly have a bottle of it in your medicine cabinet right now. You'll meet Eleanor, Robert, Margaret, and Harold one more time because each of them has lived part of this story. And by the end, you will know exactly what to take to your next appointment, what to ask your physician, and what may need to leave your nightstand this week. Before we go any further, one important note. Nothing in this video replaces the advice of your own doctor. Do not stop any prescribed medication based on this video. Some of the pills I will discuss are essential for the right patient at the right dose, and stopping them suddenly can be more dangerous than continuing them. The information here is meant to inform the conversation with your physician, never to replace it. If you are in stage 4 or stage 5 chronic kidney disease, are on blood thinners, ACE inhibitors, ARBs, or diuretics, please continue working closely with your nephrologist on every aspect of your care. Now here is the truth that few doctors have the time in a 12-minute appointment to explain. Almost every medication you have been told is safe was tested in clinical trials that excluded adults over 65, that excluded patients with reduced kidney function, that excluded the very population most likely to be taking the drug for years on end. The label on the bottle says, safe for adults. The fine print never says, safe for adults over 60 with declining glomerular filtration. That gap between the population studied and the population swallowing the pill is where nephrologists draw the line that the rest of the medical system does not. Tonight, you are going to learn where that line is. Stay with me until the end, because pill number 1 is the most surprising on this list, the most heavily advertised, and the one almost every senior over 60 in America has been told for decades is not just safe but actually protective. Recent science says otherwise, and it is the reason this video may be the most important 9 minutes you watch this year. If you are already feeling that pull of recognition, that this video is for you, that there are bottles in your bathroom that have never been seriously questioned, do me one favor right now before we continue. Tap the like button. It tells YouTube to put this video in front of other seniors who have those same bottles, who have never been warned, and who deserve to hear exactly what you are about to hear. Pill 4. High dose, long-term acetaminophen. The 4th pill on this list is the one almost every senior reaches for the moment they put down their ibuprofen. Acetaminophen. The active ingredient in Tylenol, Excedrin, NyQuil, and dozens of cold and flu combination products. After watching the earlier video in this series on ibuprofen and the kidneys, many of my patients have done exactly what they were told to do. They switched to acetaminophen as a safer alternative. And in moderate doses, for short courses, that switch is correct. Acetaminophen is genuinely gentler on the kidneys than long-term ibuprofen. The mistake nephrologists themselves refuse to make is treating that gentler profile as a green light for unlimited use. The data on long-term, high-dose acetaminophen tells a different story than the headline most patients have heard. A 2022 systematic review published in the Journal of the American Society of Nephrology analyzed 11 studies of regular acetaminophen use in adults over 60 and found that those consuming more than 3 grams per day for more than 5 years had a 23% higher risk of progression to chronic kidney disease compared to non-users. That risk is lower than the risk from ibuprofen, but it is not zero. And combined with the well-documented liver toxicity of high-dose acetaminophen, the cumulative cost to a senior body is significantly higher than most patients ever realize. Margaret, 66 from Tampa, the patient you have come to know across this series, switched from her 19 years of ibuprofen to a daily 2-tablet acetaminophen regimen for her knee pain. Her kidneys improved on blood work once the ibuprofen stopped, but her recovery plateaued after 6 months and her liver enzymes began to drift upward. We replaced the daily acetaminophen with topical diclofenac gel applied directly to her knee. 2 grams of fish oil daily, 2 grams of curcumin combined with black pepper, and gentle physical therapy. Her blood work resumed its improvement. Her liver enzymes normalized. The lesson was simple. Acetaminophen is not the answer to ibuprofen. Topical and natural anti-inflammatories are. If you take acetaminophen, keep it under 2 grams per day. Keep it for short courses, no longer than 10 consecutive days. And ask your physician about topical alternatives for chronic joint pain. That is the line nephrologists draw for themselves. That is the line you should draw for yourself. Pill-free, aluminum and magnesium-based antacids. The third pill on this list is one that most seniors do not even think of as a pill. The over-the-counter heartburn relief. Mylanta, Maalox, Rolaids, the chalky liquid suspension. Patients swallow these for years because they are sold without prescription, because they are inexpensive, and because they appear to be nothing more than calcium and minerals. The problem hides in the active ingredients almost no one reads on the label: aluminum hydroxide and magnesium hydroxide. In a younger kidney, the small amounts of aluminum and magnesium in these products are filtered out without difficulty. In a kidney over 60, particularly one with even mild reduction in glomerular filtration rate, both minerals begin to accumulate in the bloodstream over months and years. Elevated aluminum has been linked to bone disease, neurological symptoms, and accelerated kidney decline. Elevated magnesium can cause dangerous heart rhythm disturbances and worsen the function of weakened kidneys. A 2018 study in the journal Kidney International examined long-term users of aluminum and magnesium-based antacids over the age of 65 and found that those using these products more than 3 times per week for over 2 years had measurably elevated serum aluminum levels and a 14% faster decline in kidney function compared to age-matched non-users. The authors of the study made an unusually direct recommendation. They suggested that adults over 60 with any degree of reduced kidney function avoid aluminum and magnesium antacids entirely and use calcium carbonate-based alternatives, or better yet, address the underlying reflux through diet, weight management, and meal timing. This is also where the bedtime habits I covered in the previous video matter most. The reason most seniors reach for an antacid at night is reflux from a heavy late dinner. If you finished your dinner 3 hours before bed, as I described in the 7 bedtime habits video, you may not need the antacid in the first place. The simplest fix to a medication problem is sometimes the elimination of the reason you took the medication. If you have nighttime reflux that has driven you to chronic antacid use, ask your physician about safer short-term options. Address your dinner timing, raise the head of your bed, and have an honest conversation about what the antacid is actually doing inside an aging body. Few doctors have the time in a 12-minute appointment to walk through this. That is the reason I make these videos. Before we move to pills 2 and 1, both of which are bigger, more entrenched, and more surprising than the first two, I want to ask you to do one specific thing right now. If you have someone in your life over the age of 60 who takes any medication regularly, a spouse, a sibling, a parent, a neighbor, a friend from church, type their name in the comments below as a personal reminder to share this video with them tonight. The act of writing the name commits you to the conversation, and the conversation may be the one that protects their kidneys for the next 10 years. Pause the video, type the name, then come back. Because pill number 2 is the one almost every senior in America takes nightly without ever questioning it. Pill 2, diphenhydramine-based sleep aids. The second pill on this list is the one I most want every senior in America to remove from their nightstand. Diphenhydramine. The active ingredient in Benadryl, Tylenol PM, ZZ-Quil, Unisom sleep gels, Advil PM, and almost every over-the-counter sleep aid sold in the United States. Marketed as gentle, marketed as non-prescription, marketed as the safe choice for occasional insomnia, and used by an estimated 13 million American seniors every single night, often for years without interruption. What diphenhydramine actually does inside an aging body is far darker than the marketing suggests. It is a powerful anticholinergic, meaning it blocks the neurotransmitter acetylcholine throughout the brain, the heart, the bladder, the gut, and the kidney. In a young brain and body, the anticholinergic effect is mild and short-lived. In an aging body, it is amplified, prolonged, and cumulative. Anticholinergic burden in older adults has now been linked in major studies to accelerated cognitive decline, increased risk of falls, urinary retention, and, most relevant to this video, measurable harm to kidney function across years of regular use. A landmark 2015 study published in JAMA Internal Medicine followed over 3,500 adults aged 65 and older for 7 years and found that those with the highest cumulative use of anticholinergic medications, with diphenhydramine as one of the most common, had a 54% higher risk of dementia and a measurable decline in renal clearance of waste products compared to non-users. 54% from a sleep aid sold without a prescription. A 2019 follow-up review in the journal Drugs and Aging recommended that adults over 65 avoid diphenhydramine entirely as a sleep aid, regardless of dose or frequency. The mechanism inside the kidney involves both reduced renal blood flow during sleep, which directly opposes the natural overnight repair window I covered in the bedtime habits video, and impaired tubular function due to anticholinergic effects on bladder emptying and urinary retention. The senior who takes Tylenol PM every night is not just suppressing their melatonin and disrupting the deep sleep stages where kidney repair happens. They are also blocking the kidney's overnight clearance of waste products and forcing partial urinary retention, both of which compound across thousands of nights into measurable kidney damage. The fix is hard but essential. If you currently take a diphenhydramine-based sleep aid more than 2 nights per week, schedule a conversation with your physician this month. Ask about the 60-second diaphragmatic breathing practice from the Bedtime Habits video. Ask about non-anticholinergic sleep options if a medication is truly required. Ask about correcting the underlying cause of insomnia: late caffeine, late screens, evening alcohol, untreated sleep apnea, rather than suppressing the symptom with a pill that is quietly damaging 2 of your most important organs at the same time. If this section alone has named a pill that is on your nightstand right now, write the word nightstand in the comments below. It will tell me how widely this problem reaches into the homes of seniors across America, and it will commit you to the conversation with your physician this week. Pill 1. Daily low-dose aspirin for primary prevention. The first pill on this list is the most surprising, the most entrenched, and the one almost every senior over 60 in America has been told for decades is not just safe, but actually protective. Daily low-dose aspirin, 81 milligrams, the little orange tablet, the pill your doctor told you to take in 1998 to prevent a heart attack. The pill your friends from church take, the pill you have probably been swallowing every morning for 15, 20, 25 years. And the pill that recent landmark research has shown is, for the majority of adults over 60 without prior cardiovascular disease, doing more harm than good, including measurable damage to the aging kidney. I want to be very precise here. If you have already had a heart attack, a stroke, or a documented cardiovascular event, low-dose aspirin remains beneficial in most patients, and you should continue it under your physician's guidance. The drug is not poison. The story I am about to tell you applies to primary prevention, the use of daily aspirin in seniors who have not yet had a cardiovascular event, but who were told to take it as a precaution. The science changed in 2018. 3 major randomized trials, including the landmark aspirin trial published in a New England Journal of Medicine, evaluated daily low-dose aspirin in over 19,000 adults age 70 and older without prior cardiovascular disease. The trial was halted early. The aspirin group was not living longer. They were not having fewer heart attacks. They were experiencing significantly more major bleeding events, including bleeding inside the kidney itself, and the harm was outweighing the benefit. A subsequent aspirin analysis published in the Journal of the American Society of Nephrology in 2022 found that daily aspirin in this population was associated with a measurable increase in markers of kidney injury and faster GFR decline over the 4-year follow-up period. The mechanism is the same family of injury you learned about in earlier videos. Aspirin is an NSAID just like ibuprofen. It blocks the same prostaglandin pathway that keeps the small arteries feeding your glomeruli open. At low doses, the effect on the kidney is smaller than ibuprofen, but it is not zero, and across years it accumulates. Combined with the elevated bleeding risk into the kidney's own delicate vessels, the cumulative cost to seniors without prior cardiovascular disease is now widely accepted as exceeding the cumulative benefit. The American College of Cardiology and the American Heart Association formally updated their guidelines in 2019 to recommend against routine use of aspirin for primary prevention in adults over 70. Most seniors have never been told. Most family physicians have not had the time to revisit a prescription written 2 decades ago. Most patients refill the bottle out of habit, out of memory of an old conversation, out of the assumption that if it was right then, it must still be right now. It is not. I think of Harold, the 72-year-old man you met in the 3rd video of this series, the one whose GFR was 31 when he walked into my office in tears. Harold had been taking 81 milligrams of aspirin every morning for 23 years. He had no history of heart attack. He had no history of stroke. The aspirin had been started in his late 40s on the advice of a cardiologist who is now retired, and the prescription had been refilled by every subsequent physician without question. We removed the aspirin with the agreement of his current cardiologist. We added the dietary protocol from the first video. We started the hibiscus, ginger, and lemon tea. We adjusted his medication timing as the bedtime habits video describes. 8 months later, his GFR had climbed from 31 to 43. The aspirin alone was not the cause of his decline, but it was contributing, and removing it was one of the changes that turned the trajectory around. If you take daily low-dose aspirin, and you have never had a heart attack or a stroke, this is the conversation to have with your physician at your very next appointment. Bring the citations to the aspirin trial and the 2019 American College of Cardiology guideline update. Ask one simple question. Doctor, given my current cardiovascular risk and my current kidney function, is daily aspirin still the right choice for me? The answer may have changed since the prescription was written. Most physicians will respect the question. Most insurance covers a follow-up visit to discuss medication review. And the answer may quietly change the next decade of your kidney function. If this video helped you, 3 things matter right now. First, tap the like button if you have not already. It is the single most powerful signal that pushes this video into the feeds of other seniors who need it. Second, Share this video with one specific person over 60 in your life today, not tomorrow. A spouse, a sibling, a neighbor, a friend from church. Most seniors are taking at least one of these 4 pills tonight without any idea what it is doing inside them. Third, type the word kidneys in the comments below. It tells YouTube that this video is sparking real conversation, and it pushes it into the feeds of the seniors who need it most. And remember, your kidneys have to last you another 30 years. Take care of them like the precious, irreplaceable organs they are. Right after this video, I'd like you to watch the next and final one in this series. It is called the 5-Minute Morning Cup that protects aging kidneys for life. After 9 videos on what to add and what to subtract, the final video brings the entire system into a single morning ritual that takes less than 5 minutes, and that I want every senior over 60 watching this channel to begin tomorrow morning. The link is on your screen now and pinned in the description. I'm Dr. Richard Foster. Take good care of yourself. Your kidneys still have many good years left in them.